All right. Good afternoon, everyone, and welcome to the latest installment in CareOptimize Insights17 webinar series. I'm your host. My name is Jan Haskell-Moore, even though it says Jonathan DeVera. I'm in disguise. And just so everyone knows, everyone is being muted when on entry into the webinar, so everybody is muted, just so you know. Also, there won't be a formal question and answer period at the end of the webinar, but you are invited to ask questions in the chat section, and we'll make sure someone gets back to you as soon as possible. We will also keep the contact slide up for a while at the end of the webinar. Rhonda, if you wouldn't mind doing that just for a minute or two at the end of the webinar, so you can copy down email and phone information. Today's webinar is presented by Rhonda Young, Director of Strategic Accounts at CareOptimize. Rhonda's been in the healthcare field for more than 25 years, and the first 20 of those were in a clinical setting, so she has direct experience with HIPAA and its issues. And without further ado, I will now turn it over to Rhonda.
Thanks, Jan. So good afternoon, everyone, and I hope you're having a good week so far. So just a little introduction. When I was asked to give one of these webinar series this week, the topic is usually up to the presenter, and we've been bombarded with MIPS and MACRA and all of the information that goes along with that. So I wanted to kind of just shift gears a little bit and try to find something else, a different topic that maybe people kind of put in the back of their mind and just bring it to the forefront. So I did a little research on, trending healthcare IT, and also found in one of my nursing magazines some pretty good information about HIPAA technology. And one of the things that I wanted to mention is that this is some helpful information to start getting you thinking about your security risk analysis for your MIPS for 2017. And just with meaningful use, the security risk analysis is required. So some of these things that we're going to look at today are things that you'll be required to perform a risk analysis on. So it kind of just gets you thinking about, how you're using your technology and how you're protecting it. So the first thing we're going to look at is, sorry, hold on here. My slide is not going. Okay. The first thing we're going to talk about is remote access to your EHR. And so with technology's growth, you inevitably get more accessibility to your EHR. You can access it through phone, you can access it through your home computer, your laptop, your iPad. But with all of those things becomes a higher risk for releasing your PHI information inappropriately. And most of the time it's not even that you even realize that you're doing it. So one of the things that we want to look at is how secure is your remote access within the EHR. So a couple tips would be making sure that you have a two-step authentication for whenever you have to remotely access. I deal with a lot of different facilities, a lot of different clients, and there's many different ways that I access different databases. But typically, I'll find that we have to connect through a VPN, which authenticates you as the user, and then you do a second step through like a remote desk application, something like that. So it is pretty important that you do have some type of two-step authentication. And this just allows the server that you're working on to know that you, the user, do have appropriate access to that. Also, you want to make sure that all of your devices have some type of termination session set. And this is just a predetermined amount of time, which just allows you to say, if the physician has logged in on the EHR through their iPad, for example, they're working on it at home, and they set the iPad down because they're going to go outside and play ball with the kids or whatever. This does set a termination on that iPad so that it does go ahead and log that session out after a predetermined amount of time. That's pretty important because, if you leave your device sitting around and somebody can pick it up, it's less likely that they would be able to access the data if you did have a termination session going on that device. Firewalls, personal firewalls are extremely important. Making sure that whoever has remote access to your EHR system, work with your IT department. Make sure that those devices have been brought into the IT department to be evaluated for the appropriate firewalls. If you're working on a personal laptop at home and you don't have the appropriate virus software, you don't have the appropriate firewalls, all of that gives open access to your servers. And there's nothing worse than somebody having a laptop at home and they get some type of virus and it creeps right on into your server. So you do want to make sure that any personal laptops, personal cell phones, those types of things are evaluated prior to giving access to the EHR. And then lastly, place an embargo on clinicians from remotely accessing EHRs. And what I mean by that is, make sure that the physicians understand what the rules and regulations are to remote access. Have them sign a security agreement. You don't want your facility to be at risk simply because one of your nurses, accessed remotely from home inappropriately, or a physician remote access and someone had access to that data. So just making sure that everybody that has that remote access understands what their rights are and what your rights as a facility are, and have them sign agreements that indicate that they understand that. And then with today's technology, of course, we have all of these smartphones now, and physicians just absolutely love having access to the EHR through their mobile devices. Makes it very nice. It's very efficient for them to be able to, take a phone call and log in and say, yeah, I can see that, here's your test result, and I'm going to go ahead and call this prescription in for you, that type of thing. But with that does come risk. So I found this very interesting statistic that 68% of HIPAA security breaches come from missing and or stolen devices. And so that does equate to a very large amount of violations. So we often think about HIPAA violations being done in the office, and it's really actually a small amount of things that are done within the office. It's things like laptops that are not securely latched down within the offices. And, laptops are very small anymore. And you have so many people coming in and out of the offices, vendors, home health agency representatives, patients, and they can, if those devices are not securely latched on, those things can just be picked up and walked away. And many times they have all the software that's necessary to do remote access. And so with mobile devices, you need to make sure that your devices are encrypted, that they're password protected, and that they have the proper safeguards. So also look at your EHR and determine what is the process for accessing your EHR through your mobile device. Make a decision, is it secure enough for me to warrant implementing it? For example, I know there are several EHRs that when you try to access the EHR through a mobile device, the system will issue you a remote access token. And so you have to have that token and use that token within, sometimes it's 30 seconds in order to access the data. So you want to just make sure that, rolling back to the very beginning, is there a two-step authentication method? So, for example, do you have to have a username and password to get the token? And then once the token gets you in, do you have to have additional security? So it's very important to make sure that clinicians understand using the mobile device and making sure that they understand how to use it securely. And then for tips for accessing your EHR, again, and we know this across the board, that people should only access patients' information if they're directly involved in their care. What I call this is, when I'm talking with people, I usually call this as breaking the glass. And so what I mean by that is, when I'm working in a clinic, I want to know that when you access a patient's chart, that you have a true need to access that patient's chart. And we know that, sometimes coworkers can, open up another coworker's chart, or, my next door neighbor was in here, let me see what they're in here for. That is not a true need to break the glass. So you want to make sure that everyone understands that policy within the office. And do you have safeguards in place that you're able to report on this? Because if you have a patient that comes back and says, that they feel like that there was a breach in their patient information, you want to be able to go back and really be able to see who accessed that patient's chart, what day, what time, and what did they look at. So making sure that all of your staff are aware that they have to be involved in the patient's care in order to access the patient chart. Many practices will have staff sign agreements that they understand this. I've been in practices before where this is actually, a fireable offense because it is taken very seriously. So again, just make sure that your staff understand that, breaking the glass, they have to be involved in the patient's care. And, you definitely would not want to get involved in an audit to see who accessed the patient's chart and find out that it was accessed inappropriately. Another thing about today's society is emailing and texting. And as we all know, emailing and texting is part of our daily life anymore. We tweet, we instant message, we Facebook. So emailing and texting is just a way of life. But the technology moves so fast that we haven't caught up with how to keep things protected. So a couple things to think about is when you're emailing, make sure that you're emailing from a secure network. If you are not emailing from a secure network, do you have a way of encrypting that email? If you do not, then there should never be any patient data within that email. If you are sending out some type of spreadsheet, for example, that might have some patient demographics, make sure that you're password protecting that. And then along with that, don't send the spreadsheet and the password in the same email. See if you have two different ways of sending that information. So, for example, maybe you can email the spreadsheet and then text the person the password or something like that. But make sure that, your emails are kept secure. Make sure that if you are sharing information that it is encrypted, and if not, you need to find a different way to share that information. Make sure that you're providing the appropriate tools to your staff to be able to be HIPAA compliant. We always encourage using the patient portals. That's technology's way of keeping up with emailing and texting, providing a secure messaging through patient portals. And then lastly, of course, we have social media. And I kind of already touched on social media a little bit. We tweet, we Facebook, we Instagram, we do all of these things. And we do all of these things, and we don't really think about, who's looking at it. For example, I tell my daughter all the time, once you put something on Facebook, you might as well realize that it's out there for the rest of your life. So we have to be very careful about how we're using these social media pages within the healthcare field. I know a lot of physicians have personal Facebook pages, and there's nothing wrong with that. The one thing that you just want to do is discourage your providers from allowing patients to double as friends. And what I mean by that is, if Dr. Jones is my physician, and I say, Dr. Jones, I'd like to be your friend on Facebook and be able to see everything that you place on Facebook, that he should decline that, because you want to make sure that your patients don't use that as a medium to contact their physician. Because what they can end up doing is hurting themselves and the physician by just asking personal questions about their health care, and now it's out there for everyone to see. And it's not really the provider's fault. The patient basically released that information on themselves. But so in order to avoid that, it's a good idea to just train your staff train your providers, look, it's okay to have these pages. It's okay to, participate in social media, but avoid bringing patients in. And that goes across the board, not just providers, but also staff, medical assistants, nurses. Staff tend to get very close with patients, and, so patients would look them up on social media, that kind of thing. But we should really discourage that. Also blogging. I, as a nurse, I do a lot of blogging, but I'm very careful to make sure that when I'm talking, about specific things, that I make sure that I don't make it so that it seems like I'm talking about one specific person. So if your physicians like to blog about things, unless it's a specific case study where they have been given permission to give that information, you want to make sure that you keep these things very generic so that no patient can come back and say, hey, I think you're talking about me here. You want it to just be kept very, very generic. And another thing is, just making sure that we don't provide healthcare guidance to patients via social media. Again, we want to encourage the patients, if you want to communicate with us, please use the patient portal. We don't want you texting us. We don't want to text you. When you text people, you never know who's on the other end of that text. I think we're all guilty of, we think we're texting our husband or our mother, and we're texting, an unknown person. So you have to be very careful about how you're sharing healthcare information with the patient. And so, again, it's just keeping up with today's technology and thinking about, what are you using to access your patient's information? And there are so many opportunists out there now that, are able to just hack into things, not only to steal patient health information, but, we all carry a lot of patient demographics within our EHRs, Social Security numbers, dates of birth. Some clients will keep credit cards on file. So all of those things, you just need to make sure that you are protecting your patients and making sure that everything that you have within your EHR is secure. And keep up with today's technology. Make sure you know what your physicians have, how are they accessing the EHR, has everything been encrypted properly, and make sure that they're all signing security agreements. So those are just some tips that I have for everybody to start thinking about when you're preparing for your security risk analysis for 2017, making sure that you're aware of all of these things so that when you do get ready to do that analysis, you'll be able to say you have a minimal risk. So those are all my points for today. I thank you for joining the webinar. Please feel free to email me with any questions that you might have. Or if you do have any questions and you'd like to put those in the chat, I'd be willing to answer those for you as well.